In Section 2, we will learn about modes of transmission for hepatitis A, hepatitis B, hepatitis C, hepatitis D, HIV AIDS. How do bloodborne pathogens enter your body? There is direct transmission through open cuts and nicks, skin abrasions, dermatitis, mucous membranes of eyes, nose, and mouth. There's also indirect transmission through touching of a contaminated surface and transferring the infectious material to your eyes, mouth, or open sore. Intestinal organisms, including HAV, cause disease in children, caregivers, and teachers, and close family members. In the educational and childcare setting, where you're constantly changing diapers and taking students to the bathroom, it is very easy if you're not careful to spread germs by the way of this fecal-oral route. This is why proper diapering technique and washing your hands and washing the students' hands are very important, especially before meals or when preparing and serving food. Hepatitis A, HAV. About 33% of individuals in the United States have evidence of past infection. However, they do not show any signs or symptoms of the infection. It is estimated that 125,000 to 200,000 people in the United States alone are infected each year. Hepatitis A virus is spread through person to person by putting something in the mouth that has been contaminated with the stool of a person with hepatitis A. Hepatitis A is spread through transmission called fecal-oral. The virus is more easily spread in areas where there are poor sanitary conditions or good personal hygiene is not observed. If symptoms are present, they typically occur suddenly and may include fever, tiredness, loss of appetite, nausea, abdominal discomfort, dark urine, and jaundice. Older people are more likely to have the symptoms than children. Symptoms usually last less than 2 months. However, some people are ill as long as 6 months. The average incubation period for hepatitis A is 28 days. Hepatitis A. So what can you do to prevent it? The most single effective way to prevent this disease is by washing hands, yours and the student's hands, especially after diapering or using the bathroom or when preparing, serving, or eating food. Sanitizing contaminated surfaces will also help the prevention of this disease. We'll talk more later on about hand washing, cleaning, and sanitizing surfaces. Another route for spreading germs that cause infection is the blood contact route. Bacteria and viruses carried in the blood, such as hepatitis B, pose a small but specific risk in educational and childcare settings. Other diseases spread by the blood contact route is HCV, HDV, HIV, and AIDS. How are bloodborne infections spread through the educational and childcare setting? Through bleeding injuries, bloody noses, biting that breaks the skin, open draining sore, loose teeth that causes bleeding, changing band-aids or dressing, any task that involves visible blood. Hepatitis B, HBV. HBV can cause lifelong infection, cirrhosis or scarring of the liver, liver cancer, liver failure, and death. Approximately 1 million individuals in the United States have chronic HBV infection. Globally, it is over 350 million and contributes to approximately 620,000 deaths each year worldwide. It's spread by contact with infected blood, sexual contact with an infected person, drug use, or from mother to child at birth. It is not spread through water or food or sharing or eating with utensils, breastfeeding, hugging, kissing, coughing, sneezing, or by casual contact. Hepatitis B symptoms are flu-like symptoms such as headaches, muscle aches, loss of appetite, nausea and vomiting, weakness and fatigue, joint pain, or jaundice, which is yellowing of the skin and whites of the eyes, or dark urine. How is hepatitis B spread? The virus is spread through person to person where blood from an infected person enters an open cut or splashes into the eye or mouth of another person. It is also spread by sharing any equipment to inject drugs or puncture the skin. It can also be spread through tattooing or body piercing. It is also transmitted through sexual contact. Although the virus can be found in saliva, the amount of the virus is so low that the spread is very unlikely. HBV virus can remain contagious on surfaces for 7 days. Hepatitis B is a vaccine-preventable disease. Hep B vaccinations are available at no cost at 2 designated at-risk employees who have occupational exposure to bloodborne pathogens. The choice for the HBV vaccinations is not mandatory. If an employee chooses not to have the vaccination at the time of the initial offering, they will have another opportunity to be vaccinated when they are ready. The vaccination consists of a series of 3 inoculations over a 6-month period. Vaccinations will be performed under the supervisor of a licensed physician. SCO staff can contact Human Resources regarding the Hepatitis B virus vaccination program. District staff can contact their Human Resources department regarding their Hep B vaccination program. Hepatitis C, HCV. How is it spread? Through blood or body fluids containing blood, sharing any equipment to inject drugs, tattoo and a body piercing. Sexual exposure can occur but less likely. Infected during childbirth, but this is rare. Approximately 3.2 million individuals in the United States have been infected by HCV. Out of those 3.2 million, 2.6 million are chronically infected. 70% of infected individuals have chronic liver disease. In 2010, approximately 34,000 deaths in the United States were from liver disease. HCV and cirrhosis, caused by the overuse of alcohol, are the leading cause of liver transplants. Hepatitis C symptoms. Most don't even realize that they're infected because they don't look or feel sick. Between 20 and 30% of infections are symptomatic, which means they show signs of the virus. Primarily spread through contact with infected blood. 60% are related to IV drug use. Adults may not have symptoms until after 10 to 30 years of being infected. Symptoms may include jaundice, fatigue, and abdominal pain. Let's do a recap here. Hepatitis C is not spread by sneezing or hugging, or kissing, coughing, food or water, sharing or eating with utensils, or drinking glasses or casual contact. How is hepatitis C controlled? There is no vaccine to protect against hepatitis C, but there are new medications that can cure over 90% of those treated. Hepatitis D, HDV, is also spread by the blood contact route and can be a more severe disease. You can only contract hepatitis D if you already have hepatitis B. Hepatitis D, also known as the Delta virus, is an infection that causes the liver to become inflamed. This swelling can impair liver function and cause long-term liver problems, including liver scarring and cancer. This virus is rare in the United States. There is no vaccine available at this time for HDV. HIV, human immunodeficiency virus, is a virus that affects the body and in the most severe infections, progressively destroys the immune system, causing a condition called AIDS, or acquired immunodeficiency syndrome. How is HIV AIDS spread? Contact of mucous membranes or openings in the skin with infected blood or body fluids that contain blood, semen, or cervical secretions. Sexual contact, contaminated needles or sharp instruments. Women infected with HIV can pass the virus to their unborn child. Blood-to-blood transmission, when the infected blood enters the bloodstream by blood transfusion, breaks into skin, mucus, or needle sticks. HIV is not spread by the type of contact that occurs in childcare or school settings. It is not spread through non-bloody saliva, tears, stool, or urine. Studies looking at the transmission of HIV have been able to show that HIV is not a highly infectious agent. The major routes of transmission are through sexual contact, through contact with the blood or body fluids containing blood, or from mother to child during the birth process. Several studies have shown that HIV-infected people Do not spread the HIV virus to others of their household except through sexual contact. How is HIV/AIDS controlled? The same universal precautions that we've been talking about should be followed when handling blood or body fluids containing blood.